Have you ever wondered about acupuncture and labor induction? Something that we hear a lot of when it comes to inquiries coming to Lotus Care, Acupuncture, and TCM clinic is this very specific question. When should I start acupuncture to prepare for birth? And what does that actually look like? What does that mean? What is actually happening? What is the mechanism? One of our most recent inquiries of this nature was this woman that approached us when she was 31 weeks pregnant. She was a bit nervous, quite excited, mostly curious, mostly wanting to feel ready and to know that she's doing all that she can to prepare her body and to prepare baby for that eventuality. Here is how I like to explain the phenomena from the TCM perspective. Imagine your body and your channels as rivers preparing to approach and integrate the ocean. That is your birth in essence. Your chi is the current. Your blood and fluids are the water. The Chong and Ren vessels are the channel, so to speak. Your kidneys are the reservoir that hold all, and your spleen are the riverbanks holding everything in. Your heart is the harbor master, guiding the tide, and your liver keeps everything moving, governing the free flow of chi in all the channels, while the lungs open the vent so the tide can descend. So as you can see with these metaphors, there's so many interconnected communications between channels and organs, and we just want to encourage everything to flow as it needs to so that everything can arrive where it needs to. In this way, the channel is open, the tide is moving just right, and this will give all the right signals from your body to baby's body, your mind to baby's mind, your spirit to baby's spirit. Here's what that can look like across the final weeks. Weeks 32 to 34, we dredge and align. That means clearing any dampness or tension, opening the chest, and allowing the breath to invite descent. When we speak of descent, we're talking about chi flow and the mechanism of chi. So essentially, you think about like stomach chi, you want stomach chi to go down, to help flow that digestive system from stomach to intestines. And sometimes we have rebellious stomach chi. So acid reflux is really common in pregnancy, as we know, because baby is slowly, more and more gradually pressing on the stomach and making less space for the lungs to expand. Dampness, that would be working with the spleen and the stomach or digestion, making sure that the stomach chi is flowing downward instead of being rebellious and flowing upward from the pressure of the fundus of the uterus pressing up against the stomach. And when we talk about the lungs opening the breathing space, of course, the uterus is also encroaching on the lung space, the space that the lungs were taking up to expand before. So this can also be like a feeling of tightness here that the pericardium channel can also help with. When it comes to tension, this can be the liver channel, but we don't want to overstimulate the liver, especially when it's just early, 32 to 34 weeks. It's just very gentle flow so that everything can kind of relax. There's points on the trapezius that I'm sure a lot of us get our partner to massage when we're feeling tense, but it is a point that we want to avoid. There's quite a few points we avoid in acupuncture and acupressure, so that we would only use those when it's very close to term or when you're already at term and with gradually increasing stimulation. Weeks 34 to 36, we soften and nourish, then focusing on blood and yin, warmth in the low back and feet, and simply encouraging the tissues to remain supple. So blood and yin are the cooling and nourishing substances and factors in the body. Warmth in low back and feet. This is corresponding to the importance of the Ming-Men fire between the two kidneys, as well as the right kidney, the kidney yang, that we want to be warm and Yang and Qi have to do with function in the body, so we definitely want everything functioning well. And keeping the tissues supple, this is really important when it comes to allowing the body to relax and to release that sense of guarding and holding tension. And leading up, this is very close to approaching term, where we just want to invite more relaxation. And relaxation can seem like this passive thing that should just happen, but in reality, we kind of had to make time and space for it, and a kind of ceremony or ritual around it for it to really take place fully. And I feel that's what acupuncture can do, and that's what at-home care can do. Weeks 36 through 40, this is where we're coordinating with the tide. We're working with your natural flow and timing, you and baby. So at this point, it's very crucial. We're focusing on calming the Shen. Shen is the spirit of the heart and mind. This is where we want to encourage steady breath, downward flow without ever forcing. When we soften the jaw, for example, we help soften and relax the pelvis. So at this point, we can palpate here on the side if around stomach 6, which is at the bulge of the masseter, if there's this kind of tension here, this is a good time to start stimulating the stomach channel. If there's, most of the time in pregnancy, we will stimulate yin tang, and this can be really helpful to calm the mind. We call this the hall of impressions. And so we're kind of clearing that slate, leaving space to just be open and receptive to your own body's wisdom. Simple lifestyle steps that you can take in between visits. Number 1, exhale-led breathing. What I mean by this is that we just invite a subtle, slow, deep breath through the nose and exhale for as long as we can. And as we're exhaling, we can even visualize our chi, our energy, or just some light, visualize light descending through the pelvis and into the earth. While breathing, take note of any tension in the jaw, the eyes, the forehead, the neck, and just simply let that go with every breath, affirming that with every exhale, you're releasing more and more tension. You could try to implement this for about 5 minutes a day to see how you like it, or in the morning and in the evening. Always keep your back and your feet warm. I would argue also the neck, and the head, anywhere you can, but especially the low back and the feet. That's not only warm socks and slippers, but also it would be great if you can do an evening foot soak. So whether you have an actual foot bath or it's just a bowl of warm water, bit warmer than just tepid, and you can add some sea salt or you could add some ginger slices and just let it be a moment of calm for you. So the feet have a lot of important channels when it comes to fertility and chi and blood flow to the uterus. So think about the kidney channel, the spleen channel, the liver channel. These are all running through the feet, and the kidney channel begins at the bottom of the feet. And the kidney channel is a water element channel. So it really benefits from this nice warm water. And it's water and it's also winter related. So it's easily affected by cold, I would say. If you do use a warm compress, I would suggest that you place it on the low back and avoid the abdomen so that you don't bring too much heat into the womb. We don't want cold in the uterus and we don't want too much heat in the uterus. This whole step of keeping everything warm, especially the back and the feet, is preparing the reservoir of the kidney. Step 3 would be gentle movement. So whether that's hip circles on your exercise ball or a supported child's pose on the exercise ball, you just want to invite movement and blood flow through the pelvis. Not only the pelvis, but this is very important. If you can, light walks are very much encouraged still. And even just a few minutes at a time makes a difference. I would also suggest, making a playlist that is kind of for the time when you are going to be going through labor and listening to that playlist in particular to implement positive affirmations or visualizations into those songs that you've chosen so that when the time comes, you can correlate this experience of calm and preparation into those moments where you're actively in labor. And if that music encourages some movement and hip circles, then that's even better. Number 4 would be nourishing meals, whether that is zhou or congee or broth or warm rice, warm lentils, soups, stews, adding black sesame, red dates, cooked vegetables with some, gently warming spices and herbs. Just think warm, soft, comforting, and blood building. And number 5, lastly, calm evenings. If you can have some dim lights, a face mask, a warmer on your back, let's say, a nice cozy setup. Maybe you're propped up a bit if you have some heartburn or any indigestion. And maybe you have a book or some calming music. Maybe you'll check out some of my hypnosis sessions. Just create a sense of calm for yourself in the evenings. Doesn't matter if you're able to, fall asleep or not. I do have sleep hypnosis videos if you need, but it's more just about resting. Whether or not you're actually sleeping, at least create that sense of restfulness every evening. We talked about how it seems like rest, relaxation is this passive thing, and I mean, it is. But in order to get into that habit and into that state, sometimes we need to actively choose the right setting, the right choices for ourselves, which kind of balances that yin and yang that we're always talking about. Remember, me, we are not pushing the river. We are simply encouraging and allowing it to flow, creating the right conditions and environment for that flow to occur naturally. Let's talk about what science says, because I personally love when Eastern and Western can combine and come together and integrate. I think that's the best position for both. Let me read to you from my paper. Modern studies show acupuncture is not an induction switch. It doesn't force labor, but it does support readiness. One study found acupuncture around the due date helped soften the cervix and encourage birth naturally after the estimated date. Another found it didn't make labor start on command. As I said, we're not forcing, which is actually good. It means it works with your body, not against it. Some trials found shorter active labors and less oxytocin use after the waters break, as in less induction with pitocin, which is basically a synthetic form of oxytocin. And others show lower stress levels and more satisfaction during labor. When they say more satisfaction during labor, I get the feeling they're talking about, not being forced and urged to go in a different direction than what you would like to. So less interventions overall. So overall, acupuncture can help your body prepare for labor, reduce anxiety, and support a smoother flow. So it's about readiness, not rushing. How it feels in clinic. What's happening when you receive these sessions to prepare for labor and delivery? So weeks 32 to 34, around this time, we are just gently beginning these sessions, very subtle, usually very small needles throughout these weeks. So basically we're settling your nervous system. We're allowing everything to regulate itself. As I said earlier, dredging and aligning. So very gently. Dredging sounds a bit too strong, but in a very subtle way, we are dredging whatever stagnation is there, because essentially a baby in TCM, we see this as a form of stagnation of qi and blood. Stagnant as in stuck, because we want the qi, the blood, the baby to stay there. And then as we're slowly leading up to term, we want to just gently move what is stuck so that things can flow. Weeks 34 to 36, focusing on warmth, softening. Your hips might feel looser, more relaxed, open, less tension, less cramping in the calves, for example. And from week 37 onward, this is where it's very key that we are always following your body's intelligence and your timing. listening to your body's rhythm and responding to it, always allowing, never pushing, never forcing. So during a session, most people describe this sensation of being almost in between wake and sleep, or sometimes we do have a nice nap, but essentially everything kind of just lets go. Any tension in the jaw is released. The sinuses can open. During congestion, we can add a couple extra points that are both calming the mind and the Shen, but also opening up the sinuses, the nasal pathway, to have that open breath and allow the lung qi to descend, which also guides the qi and blood downward slowly, gradually. And the same points that we might do at week 37 is the same points you might do when you are fully term, but with very small selection, very few points still, and very little stimulation. The stimulation will slowly, gradually build. There are also points, for example, that we would do along the urinary bladder channel when it comes to turning a baby if they are still breech. So, as always, we're tailoring to your needs, we're listening to your body and to your account of what's happening, what you feel, what you need, and addressing that. I will not be giving you any point prescriptions or descriptions of where the points are, because some folks might try to use these before they're reaching term. And even if you have reached term, that doesn't necessarily mean that baby or you are ready. There might be still some more development in the lungs. Maybe there's just not the right timing yet. So, as always, we're not going to force anything, and we stay away from sharing the induction points used, like on video. However, if you're in clinic with us, if you have already reached term and we have notice from your primary care provider, such as your OB, your midwife, and if in that communication they're letting us know that you are ready to deliver any day now, your term, you've reached it, then we can give you a handout, which is basically a page of information of where these points are, how to stimulate them, when to stimulate them. They can be used both for inducing labor as well as just allowing the cervix to soften and efface. And they also really help when it comes to during contractions. So if your partner or your friend or your doula or your midwife, whoever is able to do that for you, if they can basically stimulate and press on these pressure points during contractions, there's also studies that show this can lessen the experience of discomfort and can allow things to flow better. Essentially, patience and steadiness encourages better outcomes than forcing ever could. My name is Janique. I'm a registered acupuncturist and co-owner at Lotus Care Acupuncture Clinic in Ottawa, Ontario. I'm also a certified hypnotist. If you would like to check out any of my hypnosis sessions, whether that be for sleep or specifically my series on pregnancy and fertility, you can check that out at Mind Mallow Hypno, and that will be on YouTube or TikTok. The hypnosis sessions that I share essentially use guided visualizations, rest, relaxation to just open and allow. When your nervous system is calm and regulated, your body naturally allows and works with birth. The tide moves all on its own.